2, 1. Hi, everyone. Welcome to today's Career Chat. We are welcoming MarKay Riippa from Mercy Health St. Mary's here in Grand Rapids, Michigan, and I'm thrilled to have her. She has been a long-time partner with us in our health careers education to help young people understand what's available out there. And so welcome, MarKay.
Thank you for having me.
Yeah, this is gonna be a fun conversation. It's gonna go fast and furious for about 30 minutes. And to get started, MarKay, you know, when you were back 16 or 17, like a lot of the young people on the call, is this what you thought you'd be doing? Did you start off as a nurse, and how did you kind of get to that decision?
I always wanted to be a nurse. I think it was a real gift to have that insight when I was in high school that I wanted to be a nurse. And I got to be a candy striper. I don't know if anybody knows what a candy striper is.
No,
I don't know
you'll need to tell them.
So
You'll need to tell them.
back in the day when I was in high school, I worked in a hospital as a volunteer candy striper, and actually my uniform was a pink and white stripe. And we worked like a nursing assistant, kind of, except it was more getting water and walking with patients and visiting with them. So, but yeah, I had the gift of always knowing I wanted to be a nurse.
That's terrific. And yes, now you have to be 18 to even volunteer in the hospital, so things have changed. I'm dating myself. Candy stripers were around when I was young too. I used to volunteer in the hospital gift shop, so that's how I started kind of helping out. So you've always known you wanted to be a nurse, and kind of tell us what your education was like. A 4-year degree? Did you go through a 2-year route? What did you do to get there?
I started off with an associate degree. Where I grew up in the Upper Peninsula, we only had an associate degree program in the area. I grew up in Houghton Hancock, and so I graduated from Michigan Tech. Our closest BSN program was 100 miles away, and that just wasn't something I was going to be able to accomplish. So I was glad to get the 2-year. Nursing has evolved, and it became eventually essential to have a 4-year degree. So I went back to school once I was working and finished my BSN while I was working. And yeah, it's a few balls to keep in the air, but you can do it. You can do it.
Yeah, just so I know some of our students who've been on these calls last week and the week before know a BSN is a Bachelor's of Science in Nursing. So for the young people that are just joining us today, I just wanted to kind of spell out that acronym. And there still is a 2-year program here at GRCC, if I'm correct, and students can get in that way with a 2-year degree. But then again, hospitals are kind of asking for a 4-year. Is that the truth for Mercy Health? Are you expecting a 4-year degree for nursing nowadays?
Yes, very much. We will still hire an associate degree nurse with the expectation that they will begin the bachelor's completion right away and complete it within 3 years.
How did you evolve to end up in the oncology department? And tell us about your different paths that you've taken as a nurse.
I've had quite a few opportunities to work in different areas. I primarily worked med-surg, but oncology has always been a passion for me. I think cancer affects most families, and it affected ours when I was growing up. And so I had that insight about, wanting to be involved with people who were struggling and going through the cancer journey, and knowing the impact it had on families. So it's been near and dear to my heart. I've also worked in the ICU. Yeah, mostly ICU, med-surg, oncology. It's all been really good.
Yeah, so just for young people, again, med-surg means what exactly?
Medical surgical is pretty, I don't want to say generic, but it kind of is. It is a classification, actually, what hospitals use. So medical patients, people who come in and receive treatments. Surgical, obviously, a patient who goes to surgery and has a surgical intervention. They come to our unit, we recover them. Some patients are here a few hours, some are here overnight, some are here for weeks. Some of our patients in oncology can be here actually many weeks. So, and because of that, we develop a pretty strong relationship with those patients.
Yeah, that's one thing I'm hoping that students take out of this is that, especially in nursing, there's just such a variety, and that path can take you many places. But based on personality, you might like a job that has different patients every day and you never see them again, or like you're talking about right now, that you actually develop a relationship. And that's something for young people to start thinking about. What would they like? Because that kind of helps dictate maybe a different focus when they're doing their nursing training, or what job they want to pursue once they're out. So for you, you've developed some relationships with patients. Tell us about maybe a story or two, if you could, of how that has been impacted you as a nurse there on that floor.
Oh goodness, you know, when I hire people, I talk about the relationships. So if nurses or potential nurses or our nursing assistants are driven by that relationship-based care, meaning, you know, not just a quick visit through the emergency department, but one where you're going to spend time with people and get to know them, and they get to know you. It's a different kind of nursing in the sense of that deep relationship. We've had patients who come in, obviously, many times, and on the oncology unit through their treatment. We get to know them from the beginning of the time they're diagnosed, oftentimes, till maybe the time they pass. But you know, not all of our patients pass away from their cancer. So cancer is different these days than maybe it was 10 or 20 years ago. So patients are living with their cancer 10 and 20 and 30 years. We had a patient here about 7 years ago, young man with a young family, came in with pancreatic cancer. And I think we all know pancreatic cancer if you're familiar with Jeopardy. So Alex Trebek has pancreatic cancer, stage 4, and he's doing, I think, remarkably well. Goes to work every day. He looks pretty good. I think he's in his 70s. So I think he's an amazing example of people living a long time with their cancer, a relatively long time. So this young man, we had a young family came in. Our surgeon did surgery to remove the cancer, and he went home in about a week. And every Christmas he comes back to visit us. He's still alive after these 7 years, brings his kids in, his family, and they distribute presents at Christmas to all of our patients. And I think that's just a case where it gives us a great feeling that we were involved in his care and his recovery, to see someone doing so well, and just to watch him give back to patients, in a sense that he, you know, for all he received. So that's one patient that really stands out in my mind. We see a lot of young people as well. Right now we have several young leukemia patients on our unit who come in every 3 or 4 weeks and they get chemotherapy. We have a high amount of nurses who are in their 20s. And so you can highly relate to young people, you know, people your age with such a challenging diagnosis. But to serve somebody that way, to be involved in their healing, it's an incredible journey.
I'm sure it's very inspiring to some of the young people hearing that, MarKay, because I know that's probably a heart for many of them on this call as they're looking at health careers, just to hear you share that. So thank you for that, because that really does paint a picture. Because sometimes you can think of oncology as just everyone dying from their cancer. And it's great to hear that there's a lot of hope and that you can be part of a journey that helping people stay healthy. Yeah, for sure.
Absolutely. Absolutely.
Yeah. That's terrific. So students, feel free to ask questions, but I would like to ask MarKay a little bit about a typical day for, maybe just share what a nurse tech does on your floor in addition to a nurse, and maybe help them understand what other occupations might be there as well, because we're trying to kind of expand their options.
Sure, nurse tech. You know, and I've done work as a nurse tech too back in the early years before I got my my degree in nursing. So a nurse tech, like anybody working in a hospital, it's pretty fast paced. It's pretty intense. Great hospital environment. I've always worked in a hospital when I've worked in healthcare, and I love the hospital environment. When a nurse tech comes on, whether it's 7 a.m. or 7 p.m. in the day, most of our staff will work 12-hour shifts, but we're pretty flexible too, so we can accommodate people who are also in school. When a nurse tech will come on, get the assignment, meet with the team. We do a what's called a safety huddle. So we start the beginning of the shift with a huddle. Sometimes we start with a reflection, just to give everybody a little boost before they head out. Give an overview of the unit, what's going on, any hot spots on the unit. My unit's a 42-bed unit, so we kind of give an overview of what's happening on the unit, how full it is, what we're expecting for admissions if we know at that point. So the nurse tech meets with the RN and kind of gets an idea of what the assignment looks like. And the nurse tech heads out to see their patients, goes in, introduces themselves, gets their vital signs, see if the patient needs anything, maybe water, maybe being taken to the bathroom, maybe they're ready to be repositioned, meet and greet the family as well. In these COVID times, we don't have as many visitors in the house, but each contact with the family member, we think of the family just as important as the patient, because it's a unit, the patient and their family. So the nurse tech will have anywhere from 8 or 9 patients. So getting those vital signs, meet and greet all of their patients, getting settled. And then they'll catch up with the nurse again and get any more updates on the patients. After that point, either they're getting the patient ready, washed up for the day, changing their linens. And it sounds small, but it's so, patient comfort is such a big deal. Even simple things like clean sheets, fresh towels, those small things just speak volumes to patients that we're taking care of their every need. And then it's ambulating your patients. And
can I interrupt you? What does that word ambulating mean for some young
sure,
people that may not know that?
Sure, walking your patients. So getting them up. And oftentimes our patients have an IV, so intravenous line. They will have pumps, different pumps that pump the different medications in, or they will have different pumps on their legs because they're in bed a lot. So we have these compression stockings to make sure the blood's flowing, that it's not all just pooling in their legs, and we don't want them to get blood clots. Our patients, especially in oncology, have a lot of drains, especially if they've had surgery. So making sure all the drains are with the patient and ambulating the patient. So sometimes it even takes 2 or 3 of our nurse techs and our nurses to walk a patient. So it's a pretty big deal to get even a patient up and moving, and patients have to get up and move. Any of you who've been in the hospital, even as a patient, or when you're home sick with the flu or a cold, if you've been in bed for a long time, how stiff you get. And so our patients need to get up and walk. We weren't made to be laying in bed all day. So getting our patients moving, and that really helps their comfort. It helps their recovery. It helps their healing. And it helps them to feel a little bit less sick and more well.
So it sounds like
something go by with that.
Our
patients are anywhere from 18 to 100 years old. So we have a huge variety of age.
Yeah, because some of the students have an interest in working with like pediatrics. And so we didn't know how much student or young people are there versus how in DeVos.
Yeah, we're usually 17 to 18. And otherwise, the pediatric patients in town will go to DeVos, and that's a good thing. They're the specialty.
Yeah, it sounds like it's a pretty traditional nursing floor as far as the way you take care of your patients and build those relationships. What about the oncology doctors? And is that something they kind of come in and out, or you guys just as much part of the team? Kind of tell us what that relationship's like.
We have a great relationship with our oncology physicians. So we have our physicians, and they actually have a practice down in our first floor of the Lax Cancer Center. So I work in the Lax Cancer Center. First floor, many of our oncologists have an office there. They also have physician assistants and nurse practitioners, and they are basically on the unit all day and into the evening. And so we interact with them all day long. They're seeing our patients, patients change. And it's so wonderful to have them there and talk about care and partner with them to make a plan for the patient. And again, to help them heal, to help them get better. And I think what I like, one of the things I really like about Mercy Health is we know we can't heal everybody physically, but we work at healing their spirit. And that's a big deal for patients. I don't care what hospital you're in, healing the spirit is a huge deal.
Yeah, I think it's important for young people to hear that and see if that matches up to their values, because I've certainly heard that across the board, that's really the true heart of nursing.
True.
Wonderful. what have you really loved about your job? And maybe what don't you like about your job, MarKay?
Oh, let's talk about what I love. I love the interaction with people. I think if you were relationship-based, nursing is definitely it. But you know, it's more than even the relationship with our patients, which we develop with the families. It's that teamwork with each other. If you like being part of a team, I think healthcare is where you belong. And that's where we want you to be. So if you love that teamwork, if you love serving, and it's very much a serving profession, come on down. We are sign up for healthcare. I think that's what I love the most. Pieces of my job that maybe I don't enjoy as much, and it's just a fact of life. Paperwork. I'm not great on paperwork, but it's part of the requirement. So you do what you have to do, and you get it done. You get it done efficiently, and get back to the other thing. The things you do love. I think the pandemic has really been difficult for us because of that relationship and the fact for a while none of the hospitals were allowing visitors in at all. That's been very, very hard.
Yeah, I can't imagine for you to be responsible really to comfort your patients and try to fill a void that their loved ones would be doing. Must have been very stressful. Has that opened back up a little bit?
We're opened up a little bit. We are allowing 1 to 2 visitors depending on the circumstances. For anyone end of life, we call those extenuating circumstances, and we try to respond with compassion and be allowing for families to gather together, especially those last days or moments. We need to do the humane thing and allow families to say goodbye and allow friends to say goodbye. And we've used a lot of the technology. We've done video chats as well, but you know, it's not the same as coming and holding your mom's hand. And so I think, again, the pandemic has been hard, but again, we try to make adjustments and make exceptions to do the right thing.
Yeah, because one of the students had asked specifically, like, you know, are there any patient stories that still kind of bother you? And it seems like maybe COVID, there's probably some more stories than you had to add to that list prior to that.
When we had to really restrict the visitors, you know, and families were frustrated, patients were frustrated. I'm here to tell you too, COVID is real, and we've seen some pretty significant illness. We have seen deaths. It is real, and so I don't want to get political, but honestly, everybody, wear your masks, keep yourself safe, wash your hands. I'm speaking as a nurse right now, and a mom. You know, be safe out there, and do the socially responsible thing to keep your friends safe.
Yeah, and you know, it's a public health issue. It's unfortunate that it even has to be couched in that political statement that you just made. So it sounds, you know, every department kind of has its own culture, its own feel to it. It seems especially sad at oncology, maybe. It sounds like there's hope though, but how do you deal with some of the sadness? How do you as a professional cope with that? Because I know a lot of young people worry about that, like, maybe this is too sad for me. Maybe I don't want to have this career.
You know, I've had people ask me that a lot. When they find out that I'm a nurse, they ask me, oh, what is it like being a nurse? And then I tell them I work in oncology. And oftentimes people will say, how do you manage that? You're right, it's very difficult. What I find rewarding is working with people at intense times in their life. I think end of life is something that I'm actually very fond of, working with people at end of life, because I think there's a presence that we can have with people. I think people who realize, understand, and face their own mortality will speak in a more genuine, deep way. And those conversations I find are particularly satisfying. And for some people, they understand that, and other people find it a little difficult. And honestly, when I was 16 and 17, I never envisioned myself being drawn to having these deep, personal, difficult conversations with other people. If you had known me in high school, you would have said, wow, she's pretty quiet and she's pretty introverted. And that would be my natural. So being more extroverted, but one-on-one working with somebody, while they're going through so much suffering, there's a reward there that I find very satisfying.
Yeah, and I certainly think that there's probably some students in this group that resonate with that. I have some friends that that's something that they're drawn to really support people at that stage of life. Some of the practical things around oncology, have you ever had patients that were misdiagnosed, or is the technology just so advanced now that that just doesn't happen? Tell us about your experiences with that.
Let me see if I can think of an example. We had a patient here several years ago who was being treated for bronchitis all winter long, coughing. We have, I think, an excellent group of doctors, but remember, doctors are people, and technology isn't as simple as running some blood tests and voila, you get artificial intelligence giving you this diagnosis. Sometimes we have to work really hard, we in healthcare, to come up with an accurate diagnosis. So going back to this gentleman, I believe he was in his 70s, had a cough all winter. He was being treated again for bronchitis, but wasn't getting better. And so after a few months, did come to see one of our oncologists. They were able to diagnose him with lung cancer, which was unfortunate that we couldn't be there earlier to get started on that treatment. I think sometimes some cancers are easier to diagnose than others. I don't see a lot of misdiagnoses. I see physicians working very hard, running a lot of tests to try to find out what's going on, and getting that patient to be a partner with the physician to go through lengthy testing sometime, and keeping up, with your checks, your wellness checks. But yeah, it's not as easy as a simple X-ray and you've got the answer. Sometimes some cancers are harder to find.
And I know you've been, nursing for a few years. You mentioned, going through ICU and med surg, and now you're in oncology. How have you seen even the technology change? And are you hopeful that there's going to be a cure? Do you feel like that's on the horizon? What do you hear on the inside of the oncology world?
I'm hearing a lot more immunotherapy. It's a big deal. So, look into that, do some research on that. We're using a lot more of that for treating cancers. I think there's a huge future in that. We're doing more of genetic testing. Some cancers are a little more hereditary or genetic in that sense. Some of it is more environmental, but it's not always a 100%. It's not a slam dunk. But I think those are some exciting things that are coming down the road for us in oncology, in cancer care. And so again, early diagnosis is probably the best thing. But those are some careers to look into.
Yeah, I would recommend the young people, go to Google and put in, innovative cancer treatments, and jobs, and start to see some of those job titles that are associated with that. That's a great suggestion. I know young people, this isn't something they'll find on the career website, but how do you deal with the crying? Like, how do you not cry in front of your patients? Is it considered unprofessional if you do?
I think there was a time in nursing where we thought we wouldn't cry with patients, but actually it's okay to sit with a patient, hold their hand, and shed some tears with your patient. You don't want to get out of balance where the patient is taking care of you because you're doing more crying, but to show your humanity, to show that it hurts when your patient is hurting, it's okay. It's okay to show those emotions.
That's helpful to hear, I know, for a lot of young people as they're hearing that. In our last 5 minutes, MarKay, I want to help the young people kind of help make that transition from high school to the health field. And you mentioned nurse tech there at Mercy Health. What are the requirements for that? And what kind of qualities do you think young people should have if they're going to be successful as a nurse tech?
Oh, those are great questions, Krista. I would recommend a couple things. One, if you're a nursing student, we would hire you as a nurse tech if you've had 1 to 2 clinical rotations. Sometimes people want to start before then. So there's a certified nursing assistant program in town. It's a little bit pricey. I think it's between $1,000 and $1,500. It's a big investment, but it will help you see if that's a career you're interested in. I think what will serve people the most, what I look for when I hire folks, I look for somebody with passion for what they do. I look for people who have compassion. I look for people with energy. I look for people who are humble learners. We can teach you hands-on skills that you need. I can't teach you compassion. I can't teach you good listening skills. I can't teach you to love other people. Those are some of the qualities we look for when we hire people, and people wanting to learn. Again, that humble learner, being willing to learn and to listen and to grow. And I think for any of you who want to go into that profession, find a good mentor or somebody that will come alongside of you and help you achieve your goal.
Yeah, that's a great suggestion. Mentors make a big difference for sure. I did want to give an inside scoop to students too, that many of our long-term care, like nursing home type settings, will actually pay for your CNA training. So don't do that out of pocket until you've checked that route. But I've met many of the long-term, you start off as a resident assistant right out of high school as an 18-year-old and start working there. And if they see that you have what it takes, they'll pay for that training. But otherwise, certainly get that, because that will get your foot in the door.
And we
KCTC,
will
yes,
hire you.
Go ahead.
We will hire you with some of that experience too. So previous experience is another way, but we want you to have some experience or that CNA.
Yes, and Abigail, you make a great suggestion. If you are not a senior yet, if you're one of the younger students on this call, KCTC, the Kent Career Technical Center, has a CNA program, and you can get that training while you're in high school for free. So yes, thank you for pointing that out, Abigail. I forget that it's not just seniors on this call. So with our last few minutes, is there anything you'd like to say around the myths of your profession? Things that people think about your job that aren't true?
I don't think it's like television. It's good entertainment. Some of it's not real. I'm not sure of all the myths out there. If you want to, it's not always glamorous. You may or may not meet the spouse of your choice in your career, but that's not the reason. It's not quite General Hospital or I forget the other more recent one, so sorry.
No, you're fine.
Some of those programs, but it's hard work. It's hard work. And if you're willing to give, I'm sure you'll find in return the satisfaction from a career in healthcare.
Maybe one lesson you learned as we finish up, and then I'll let you give a word of wisdom, but what's one of those mistakes that you made that you learned from that young people shouldn't be afraid of making some mistakes?
Always stretch yourself, reach a little further than you think you can. Grey's Anatomy, thank you, is the other one. Reach a little further. Don't be afraid to push yourself. I never imagined myself in this career. I never would have imagined myself at all. Don't be afraid to push yourself. Receive feedback from other people. Ask them how you're really doing. Ask them where they see you. Ask where they see your skills and strengths. But always be true to yourself. If this is what you want, again, find that good mentor. Go forward. Do what you want to do, and again, stretch yourself. Learn all you can. I just went back to school. I just graduated with my degree in bioethics. I love the ethics piece of my work in nursing. So again, keep looking forward at what's coming down the pike with healthcare.
That's terrific. And as I switch to my slide, MarKay, did you get some tuition reimbursement as part of that?
Oh, thank you. Yes, I did. For us, it's many careers is $3,000 a year. We know that doesn't go extremely far, but you're making an investment in yourself. And again, if it brings your passion to what you do, keep making yourself current. Stay current in your career. Look forward. And we need you, so keep looking.
I wanted young people to understand that many of our hospitals, our local hospitals, have tuition reimbursement. So again, it's really important to start at some of those entry-level positions and let the hospital start to pay for those advanced degree. College debt does not have to be your experience, for sure. For those of you that are new, I wanted to point out a great resource where you could get some of the nuts and bolts information about jobs in oncology and nurse techs and physician's assistants, all sorts of jobs, and that's through onetonline.org. It's a great website to do some career research. So go ahead and write that down. And then MarKay has been generous enough to offer her email to you if you have a follow-up question. If you're thinking oncology might be a good place for you, she welcomes an email from you, and she'll get back to you when she can. Remember that she's a very busy professional, and she'll do her very best on that. And again, my name is Krista Harmon, and I'm with the Kent Intermediate School District's Career Readiness Department, and that's my email. So feel free to ask me any questions that you might have as well. MarKay, it's been so great having you. Doesn't that 30 minutes go fast?
Oh, it went very fast. And I appreciate this opportunity.
Yes, you gave some great words of wisdom there in your final couple statements. Is there anything you'd like to say before we sign off?
I'm looking forward to when we can have students back. Our nurses, our techs love teaching. We love having students, and it's, I think, one of the other rewarding pieces of our job is to inspire and teach and support.
Absolutely. Thanks again so much.
Thank you.